10 signs of iodine deficiency. As our body needs carbohydrates, proteins, and lipids, we also need minerals. As they cannot be synthesized inside the body, they must be acquired through diet. Iodine is one of the minerals we cannot ignore, as it is essential for thyroid hormone synthesis, a hormone which facilitates energy utilization, temperature regulation, and organ function. Iodine deficiency arises when the body lacks sufficient iodine intake, leading to symptoms such as thyroid enlargement and hypothyroidism. Insufficient iodine impairs thyroid hormone production, leading to various complications, especially during pregnancy. Initially, iodine deficiency may not present with any symptoms. However, as the thyroid responds to lower iodine levels by increasing hormone production, the thyroid may enlarge. As thyroid hormone levels decrease, metabolism slows down, resulting in symptoms such as weight gain, constipation, fatigue, and others. Now let's see these signs of iodine deficiency that can be missed as they are not so severe or are so common, but should never be missed. Number 1. Fatigue. Now we know that iodine is crucial for proper thyroid function, which regulates energy levels. When iodine is less in the body, it will lead to low thyroid hormone levels, causing fatigue and weakness due to reduced energy production. That is why feeling constantly tired, even after getting enough sleep, can be a symptom of iodine deficiency that you might ignore. Number 2. Weight gain, unexplained weight gain, or difficulty in losing weight, despite efforts to maintain a healthy diet and exercise regimen most of the time, is indicative of thyroid dysfunction. Thyroid hormone is essential to control the speed of metabolism in our body. When insufficient iodine levels hinder thyroid hormone production, metabolism will be slowed down, leading to weight gain. Number 3. Generalized body pain. Iodine deficiency can cause muscle weakness and pain, as the thyroid hormones play a role in muscle metabolism and function. With metabolism shifting towards catabolism, muscle breakdown may occur, leading to weakness and overall bodily discomfort. Number 4. Hair loss. Insufficient iodine levels can lead to hair thinning and loss. This happens because hair follicles require proper thyroid hormone levels to function optimally. When these thyroxine-sensitive stem cells in hair follicles are not stimulated properly, it might also cause coarsening of hair texture. Number 5. Dry, flaky skin. Iodine is needed for skin cell regeneration and sweat regulation. When there is a deficiency, it will result in dry, flaky skin and even a condition called iododerma, characterized by rough, dry, and scaly skin patches. Before moving on to the rest of the signs, let's talk a bit more about iodine. If you have observed yourself having these symptoms we are talking about, you ought to start giving your body enough iodine. Naturally, iodine-rich sources include foods from the sea and regions with iodine-rich soil. However, mountainous areas and inland lowlands far from oceans tend to have iodine-poor soil, leading to a higher prevalence of iodine deficiency in these regions. But as for many diseases, for iodine deficiency also, prevention is the primary treatment. In cases where iodine deficiency develops, treatment involves iodine replacement through dietary modifications, iodized salt intake, and potentially iodine-containing supplements. In severe cases, surgical removal of the thyroid gland may be necessary, followed by thyroid hormone replacement therapy. Now, back to the signs. Number 6. Feeling cold. Since iodine deficiency affects thyroid function, which regulates body temperature, individuals may feel excessively cold, even in warm environments. Iodine aids in heat generation, so its deficiency may result in heightened sensitivity to cold temperatures. Number 7. Irregular menstrual cycles. When one hormone is imbalanced, it will lead to misbalancing of other hormones, leading to malfunctions of body systems, namely menstrual irregularities. This irregularity includes heavy or light periods, or even amenorrhea or absence of menstruation. Number 8. Difficulty concentrating. Thyroid hormones are essential for brain development and cognitive function. Hence, iodine deficiency may lead to difficulties in concentration, memory problems, and overall cognitive impairment. Number 9. Depression and mood swings. A significant proportion of individuals with hypothyroidism report feelings of depression and anxiety, potentially exacerbated by postpartum hormone fluctuations. This happens because the thyroid hormones influence neurotransmitter activity in the brain, and iodine deficiency contributes to mood swings, irritability, and even depression. So far, we discussed the signs you might miss. The last is something you might not easily miss, but something that would alert you about the deficiency. Number 10. Swelling in the neck or goiter. One of the most noticeable signs of iodine deficiency is the enlargement of the thyroid gland, which can cause a visible swelling in the neck known as a goitre. This occurs when the thyroid gland enlarges due to heightened thyroid-stimulating hormone levels, prompted by iodine deficiency. That is not all. Iodine deficiency can also cause problems during pregnancy. Pregnant individuals are particularly vulnerable to iodine deficiency, which can lead to adverse effects such as underactive thyroid symptoms and developmental issues in infants. These include miscarriage, stillbirth, birth defects, stunted growth, and intellectual disabilities. Severe cases may result in cretinism, marked by physical and mental delays, deafness, and muscle issues. Also, if left untreated, severe hypothyroidism can cause skin swelling and thickening, protrusion of the eyes, decline in mental function, and even coma. In some cases, it can be life-threatening. So, seek immediate medical attention if you or someone you know experiences symptoms like being a danger to oneself or others, bleeding during pregnancy, changes in consciousness or alertness, changes in mental status or behavior, chest pain, respiratory problems, or other severe symptoms. If you notice any of these in your body or one of your loved ones, take action immediately. Seek the help of a medical professional and get your body the iodine it needs.